second part, we're going to talk about charting. The main chart is in the middle here, as you can see here in the middle, and this would be where you're charting right here. If you scroll up, you're going to see previous chart notes. Some of them are going to be shorter here, and some of them are going to be longer. If you want to ever minimize, you can press this and it'll shorten it, or press this and it'll lengthen it if you see any. So you'd be charting in here, and what we're going to do is we're going to be charting off of templates. And there's going to be either there's only going to be two templates. You're going to use one of those two. One will be for new patients, or consult new patients, and that could be a new patient completely, or a re-referral. So anything that requires a consult note that needs to be sent off, we're going to use something called consult, and you can type it in the search box up here, and you'll see it says consult kids. Click on it, and then you will see this chart or this template open up here. Some of it is pre-filled, and you would need to fill it out, including who the doctor is. Thank you for referring this blank, who's seen in the clinic today with blank. So it'd be thank you for referring this 5-year-old who was seen in the clinic today with her mom or such. And then you're going to see history of present illness, past surgical history, birth history. All these things are just reminders. And what you're going to do is you're going to chart underneath them. And when you are ready to present, it needs to be in paragraphic format, because this is going to be the chart note, the consult note that gets sent off to the referring doctor. So you're going to write a paragraph in here, the patient presented with, etc. And when you're done, you're going to be just getting rid of these headlines at the top. So you're just going to be left with a bunch of paragraphs. The paragraph here, the physical exam, it's pre-filled for a typical physical exam, a normal physical exam. If what you have to fill in is the heart rate, the RR, the BP, and the height percentile, the weight percentile, and the BMI percentile. I'll get back to those in a second when I let you know about how those are calculated within our system. The rest is, like I said, a normal exam. If your exam is not normal, you of course need to change this appropriately. As well, like I said, you need to fill these in, HR, RR, etc., to make sure that it doesn't look like, that we're using just the exact same template for everyone. You're going to have diagnosis, treatment plan, and then it's going to have a closing remark here. And at the bottom, and I'll say this several times, you need to write your name, so Dr., in this case, Bill Smith, and beside it, you're going to have R1 or R2 if you're an R2. R1 or R2 for Dr. Winters, or whichever doctor you're working with. It's really important that you have that, so when we send their consult letter off, it has the actual physician here who saw them, so that they'll know where it's coming from and who it should be directed to. I'm just going to delete this so we can get into the second part, which will be a follow-up. So this would be for someone that would be a consult follow-up, or a walk-in patient. Now, we don't see a lot of walk-in patients anymore, so largely this would be for consult follow-up. You would use something called kids follow-up right here. And in this part, you'd have the referring MD still, because most of these are going to be consult follow-ups from a referral. And then you're going to have a list of things that you need to go through. This does not need to be written in paragraphic format. This can be written however you like, point form, etc., because this is not going to be leaving our office. This is just specifically for internal use and internal charting, so you can chart however you want within this template. When you're done either one of these, you're going to go to the bottom and you're going to hit this one called Sign, Save, and Exit. This is going to close it up, but it's going to make sure that you have everything charted here. So if you go back in, it's going to pop up another date here because you've signed, saved, and exited this one. If you want to change it, you can click Edit. It'll allow you to go into this one and change it.